the posterior compartment of the thigh. In this video, we will cover the posterior compartment of the thigh, its cutaneous innervation, the hamstring muscles and their common features, individual muscles with origin, insertion, and nerve supply, and finally, their actions and clinical importance. Let's begin. The posterior compartment of the thigh is also called the flexor compartment. It is incompletely separated from the medial compartment by the poorly defined posterior intermuscular septum. Cutaneous innervation. The skin over the back of the thigh is supplied by branches from the posterior cutaneous nerve of the thigh. Muscles of the back of thigh. The muscles of the back of the thigh are called the hamstring muscles. They are Semimembranosus muscle, Semitendinosus muscle, the long head of the Biceps Femoris, and the ischial head of the Adductor Magnus. The hamstrings share the following characters: origin from the ischial tuberosity, insertion into one of the bones of the leg, nerve supply from the tibial part of the sciatic nerve. The muscles act as flexors of the knee and extensors of the hip. Actions. The actions of semitendinosus, the semimembranosus, and the biceps femoris. These three muscles are the chief flexors of the knee. They are weak extensors of the hip, particularly in walking. This action is important in the mid-flexed position of the hip. Note that the powerful extension of the hip is performed only by the gluteus maximus. When the knee is semi-flexed, the biceps femoris is a lateral rotator of the leg, while the semimembranosus and semitendinosus are medial rotators of the leg. Muscles of the back of thigh. Semitendinosus. It is so named because it has a long tendon of insertion. It lies posteromedial in the thigh, superficial to semimembranosus. Origin. From the inferomedial impression on the upper part of ischial tuberosity. In common with long head of biceps femoris, insertion into upper part of surface of tibia, nerve supply, tibial part of sciatic nerve, semimembranosus. It is so named because it has flat tendon of origin. Origin. From the superolateral impression on the upper part of ischial tuberosity. Insertion. In the groove on the posterior surface of medial condyle of tibia. Nerve supply. Tibial part of sciatic nerve. Biceps femoris. It has two head of origin, long head of biceps femoris and short head of biceps femoris, origin, long head. From the inferomedial impression on the upper part of the ischial tuberosity, in common with semitendinosus, short head, from the lateral lip of linea aspera, between the adductor magnus and vastus lateralis from the upper 2/3 of the lateral supracondylar line and from the lateral intermuscular septum. Insertion. It is inserted into the styloid process of fibula. Nerve supply. Long head by tibial part of sciatic nerve and short head by the common peroneal part of sciatic nerve. And that's the posterior compartment of the thigh. Hamstrings, flexors of the knee, weak extensors of the hip. See you in the next session.